My name's Amelia and I'm a clinical psychologist, and I'm going to talk to you briefly today about a piece of research that I carried out with Embrace, a local East Berkshire service that some of you may know, which has been co-produced by staff, peer mentors and service users over the last 6 years. Now, I'm aware that I'm giving this talk alone and not alongside people who have experience of using this service, which feels uncomfortable to me actually, given how much I value working in partnership with people who previously used services and are currently using services. So I'm going to try my best to do justice to the insights that the group members that participated in the research shared with me during this process. So the aim of the research was to learn about group members' experiences of co-producing the service with staff who are also group members. The research was carried out as part of my clinical training at Oxford University, and it took place over a 2-year period, which involved applying for and receiving approval to carry out the research from an NHS ethics committee, and then spending time with the service. So that meant just learning about Embrace, going along, talking to people, and then speaking on an individual basis to 10 group members who participated in the research about their experiences. So themes from those conversations that I had with participants were then pulled out. Okay, so here are 2 quotes from participants which help to explain the first theme. Okay, I'm going to read the top one. When people give you things to do, it makes you feel wanted. It makes you feel useful. Makes you feel like you're worthwhile. With mental illness, you go through a lot of stages of thinking you're useless, and I went through that quite a bit. So being involved in developing and delivering the service helped people to shift from a previous position of disempowerment and one that appeared to be more of dependency towards one of agency and empowerment. It's not them and us, it's we. We're all working together. So the first theme in the top circle there, called Regaining Power, captures how the process of co-production facilitated a shift from a previous position of powerlessness within the healthcare system towards a more empowered position. Involvement in running and developing the service appeared to be enabled by psychological safety, which you can see forms the second theme, which is that circle on the right. And then participants' attempts to decipher the co-production process are captured in the third theme, making sense of the process. And the fourth theme in the circle on the left captures how the impact of co-production impacted on the recovery journey. So dismantling that patient health professional dichotomy by working together seemed to increase collectivity and a sense of shared vision. So what it seems, and what we're now getting increasing amounts of evidence around, and what these research findings add to, is that co-production processes and approaches seem to promote recovery and well-being. Peer support is invaluable to enabling people to engage in co-producing services. And to promote and help enable involvement, it's really important that time is dedicated to clearly explaining the process to people that are involved. And finally, and very importantly, fostering relational safety is central to supporting people to co-produce services with staff. So these findings are going to be submitted to scientific journals for publication, and we hope that as more services start to adopt co-production approaches, that more this research study and others can be replicated so that we can continue to gather evidence around co-production approaches. And also this research focused on understanding the experiences of peer mentors and people currently using services. And I think next it would be valuable to have more research around the experiences of practitioners that are involved in using co-production approaches. so we can try and gather a bit of a sense of the impact of co-producing services on professionals' identity, and also the experience of attempting to transfer and share power, which is ultimately what co-production is all about.